Welcome to People. I'm Micah Mater. Big changes to Medicaid have many patients unsure about their medical care. Here with the facts and what you can do now, physician, author, and international healthcare consultant, Dr. Jeffrey Sterling. Thank you for coming in. You always have such good information. The big, beautiful bill has passed with a lot of things changing. Medicaid, for one. First of all, what's the difference between Medicaid and Medicare?
A simple way of describing it for the public is that we care for the elderly and we aid the poor. So typically individuals that are on Medicaid are 65 or older, and people on Medicaid are younger and indigent. There's a lot more to it than that, but that's an easy way to distinguish.
Okay, I like that way. Medicaid is the one that's going to be affected, though, right? How so?
Well, particularly the parts that were Medicaid expansion under the Affordable Care Act. That's not a coincidence. But simply put, there are going to be tremendous work and reporting requirements for the very first time as part of the big, beautiful bill. People really are going to have to take responsibility for making sure that they remain eligible. And a big part of the subset of people that are no longer going to be eligible are people that got in under the Medicaid expansion as part of the Affordable Care Act.
Now, that's a lot of people, right?
It really is.
2027 is when it's supposed to take effect, but companies have the option, or people have the option, or how does it work? The government has the option.
The states have the option. So Medicare, just to get back to your other point, Medicare is really a federally funded program. Medicaid is a shared responsibility of the states with federal matching consistencies. Yeah.
So an example is that Illinois, for instance, can decide they're going to kick out Medicare or Medicaid or the funding for it before 2027 because they have that option now.
Some parts of it.
Okay.
Some parts can start now. Some parts are going to start December 31st, 2026, and others are going to start January 1st, 2027.
That's a little confusing. How can we make it simple for folks out there who might be a little afraid now?
You can't make it simple, but you can share with them what their responsibilities are going to be. And there's a couple of them, so let's go through these very carefully.
Okay.
Number one, people actually need to get on the phone and call their state Medicaid office. Anyone that thinks that they are eligible, it is your responsibility to make sure that the state knows that you want to be on Medicaid. If you don't take care of that yourself, when the time comes that you need to be ill, you aren't going to be covered by Medicaid.
So everybody on Medicaid needs to get on the phone right now?
Everybody needs to, literally needs to get on the phone and make sure that they are covered. You need to make sure that they have your proper contact information, because there are going to be reporting rules that you have. They're going to start checking every 6 months to reaffirm that you're eligible to stay on Medicaid. And you can, there's a thing called the U.S. Postal Service's Informed Data consideration. You actually get to go online and to see whether or not you're still eligible. They're going to be checking every 6 months as to how they can slim the rolls of people that are eligible.
What if you're not eligible? What do you do?
Well, that's part of what the Congressional Budget Office forecasted. They projected about 17 million Americans are going to fall off the rolls of this and other insurances. The answer to your question is that it remains to be seen whether there are additional changes that are going to come in how people are able to access emergency departments, which really are the place of last resort. But that's not primary care. That's not preventive care.
That's only emergency care.
That's only emergency care, which we send people back out into the conditions that produce the same pathology to begin with.
In the first place.
That's not healthy.
Yeah. So Medicaid is not going to be covering your regular doctor visits then?
Well, no. I think that much is going to change. A lot of places, just to give you one quick example, reproductive health is going to be cut by such an extent. One of the other things that the citizens need to do is to make sure that your provider is still going to be in network. So you may still have a doctor, but if your doctor isn't eligible to receive Medicaid funds, such is the case with reproductive health in some examples, then you're going to end up with a lot of costs that end up coming to you. So we need to check, not only check with the state, we need to check with our physicians and other healthcare providers to make sure that, am I okay coming to you because I have Medicare? Medicaid. Now, the other thing that's part of this is that the work requirements are going to be quite onerous. You literally are going to have 80
hours
a month.
Oh, a month? Okay.
A month. 80 hours a month in which you either have to be working, you have to be doing community service, or you have to have one of the exemptions that allow you to stay eligible.
What if you're too sick to do that?
Depends on how you define sick.
Yeah.
There are certain exemptions to qualify under sick. Now, this is part of the reason why you have to, if you think you're eligible for Medicaid, you need to get that process done now, because all the retroactive application, that's not happening.
Yeah.
It's not going to happen, trust me on this one. So you have to stay enrolled before you get sick. Now, there's certain types of existing conditions for which you will qualify. Pregnancy is one that comes to mind. If you're pregnant, or even if you're incarcerated, There's a long list. We won't get into that, but there's some things that are exemptions. But let's talk about the rule, not the exceptions. A lot of people are going to be falling off and won't find that out until they actually do get sick.
So the thing is right now, make that call.
Make that call,
Okay.
and make sure that you do what's necessary to stay eligible.
Okay, now, what about vaccines? The CDC, well, a lot is going on with the CDC this week especially, but what about COVID vaccines? Are that going to be covered anymore, or do people have to get COVID vaccines? There's a lot changing, a lot of conflicting things going on there.
This is a tidal change in American public health. For hundreds of years, we've taken the philosophy that we wanted to eradicate disease wherever it was. And the whole idea of vaccines was just to get rid of as much of the bolus of disease that existed out in the community. That's changing. The government is now taking the position that we're not going to do that. You're going to be okay unless you're not okay. So to get to your question, COVID will now only be covered, this is like 1 or 2 days old now, COVID will only be covered for the very highest of risk individuals. And otherwise, if you want it, it's still going to be available, but the government isn't going to pay for it. So if you can afford to pay for it, you still have access to it. Otherwise, you're going to have to do what you can to prevent getting it and then avoid the complications once you contract it.
A lot of people saying kids don't need it, but we talked to someone, a pediatrician, who says kids should get it.
I don't even understand what that means, because kids are not only susceptible to disease themselves, but they're wonderful carriers. This month is called the Don't Get Sick Month, because once kids go back to school. They reverberate these diseases
They're
amongst
petri
each other,
dishes.
and they're petri dishes. They bring them back to the older grandmas who may be taking care of them, and the grandmas are the ones that suffer the fatal consequences.
Let's talk quickly about the oral semaglutide pill, which just came into existence, so you don't have to have the shot anymore.
Right.
What do you think about that?
It's an option.
Okay.
For people that, you said it perfectly, if you don't want a shot, then semaglutide pills are an option. You would have to take them first thing in the morning. You'd have to wait 30 minutes before you ate. The thing about those compared to the weekly injections is that the doses is lower, it's a more regular routine for people, but they aren't necessarily as effective, and the doses aren't going to be higher. So still better than the alternative of being obese and having diabetes. Yeah.
What about the price? Is it going to be better than the injections? Or?
Well, once again, 6 of the one hand, half dozen of the other. You're paying for a weekly injection compared to taking a daily pill. I think the correct question to ask there is whether or not you're eligible to get this covered by your insurance carrier, or whether or not you have the means to pay for it on your own.
Let's talk about the semaglutide in general. We just heard that tennis star Serena is taking Zepbound. She talked about it. And you and I were chatting earlier. You said that you are for getting it because, especially if you're obese or you're pre-diabetic or diabetic.
One of the things that interests me, again, as an emergency physician, is that people tend to focus more on the side effects than the life threats. And with 70% of Americans being overweight or obese, they don't appreciate that that directly is a path toward hypertension, diabetes, strokes, and heart attacks. Once you get those diseases, you're a walking time bomb, figuratively speaking. Whatever it is you can do that diminishes that risk is addressing a life threat. And people want to talk about, obesity face and other side effects. With all due respect, yes, there are side effects, but drinking water and breathing air comes with side effects as well if you do it often enough and at high enough doses. So my message to everybody is that if you have an option to take this, the benefits that have been demonstrated are so voluminous and so overwhelmingly healthy that whatever we can do to get back to a healthy total body weight, we should do it.
Dr. Jeffrey Sterling, always good advice. Thank you. You can find more on the work Dr. Sterling is doing at jeffreysterlingmd.com.